Hi everyone, happy Sunday. It's Tisha here with Rowe, and I wanted to just let you know about some upcoming events with telemedicine, as well as share a few frequently asked questions. I actually posted on my page the other day that I was creating a frequently asked questions section for my website. My intention was to get questions for patients, which we did. We had about 20 patient questions we recorded. But then I realized a lot of the questions that came through were actually from doctors, not patients. So I wanted to take the time to address those frequently asked questions. Hi Rachel, thanks for joining. And if you have any questions as well, please feel free to type them in the comment box and I will answer. So the three upcoming telemedicine related events I wanted to share for those of you all who are looking for CME in the year or just exploring. We had the American Telemedicine Association conference back in April, but that's not the only learning opportunity. So the next upcoming event is going to be ATA Edge, which is also hosted by the American Telemedicine Association. If you're not a part of the American Telemedicine Association, I would strongly encourage you to join. It's going to be in Austin, which is a phenomenal city. I'm in Houston, but I absolutely love Austin. It's like the California of Texas. It's so unique. It's so eclectic. It really doesn't feel like you're in Texas. So if you need a getaway, great place to come. Lots of outdoor activities. That is going to be September 26th to 28th. And you can just Google ATA Edge. But I'll also put some of the questions here in the search box as well. Then we have the Virtual Physician Summit, and this is my personal baby. I love this. Started this through a nonprofit back in 2016. This is our third year. We had Kevin MD as our keynote. We'll be announcing this year's keynote very soon. The year before that, we had Dr. Bernard Harris, a telemedicine venture capitalist, and I guarantee you this year will not disappoint. It's going to be in Atlanta on Saturday, October 6th, a one-day conference. We want you to be there. If you're looking out for information, use hashtag VPS Atlanta or hashtag VPS 2018 to get more information about the conference, or message me or comment below. The third telemedicine event I want you to be aware of is the Urgent Care Association of America conference. It's going to be October 12th to 14th, right before my birthday, and I will be speaking at the pre-conference on October 11th on telemedicine use cases for urgent care. So 3 event opportunities, just wanted to share with you all. And now I'll address the frequently asked questions. I'm going to share who the question is from, what the question is, and then my answer. Hi, Kiran, and hi, Bill. Thanks for joining in. If you have questions, please feel free to ask. I'm doing a telemedicine Q&A here, and I would love to hear from you. So the first physician question on my timeline, I posted a poll a couple weeks ago. It came from Dr. Butcher. How do I get paid, and how does pay compare to an office visit? He had a couple follow-up questions. He didn't get specific, but he said physical exam and follow-up. So the first question, how do I get paid? There are a couple different models for being paid. I recommend the entrepreneurial model, where you go through the process of getting credentialed with insurance networks in your area, and then if your state has payer parity, you'll get your full reimbursement. Option B is to work for a telemedicine company where they will pay you either a salary or a per visit. I do not recommend any doctor do a per visit, because you're giving them your time, whether or not you get patients, and you only get paid when patients come on. How does pay compare to an office visit? It's actually very promising, because most states have payer parity laws, and that means that you can be paid the same amount for a regular office visit as a telemedicine visit. Physical exam, of course, it's limited because it's virtual, but really keep in mind there's a lot of good we can do and a lot of diagnoses that we can come to without actually touching the patient. So right now, look at me, Tisha. There's a certain amount of examining coming on, right? You can see my skin color that I don't look like I'm anemic, right? You can tell I'm not pale. There's blood in my cheeks. I'm actually vibrant, you know, I don't look lethargic, I don't look toxic, anything like that. So there's a lot of information that you can get, guys, just from seeing me on camera, right? Same applies. Some of the big things I'd like for you all to think about. 1 second, guys. I have to turn off this timer. Sorry. My apologies. And so some of the things I want you to think about are like utilizing telemedicine for college students. When this is what we focus on with Rowe Docs. And when I worked on a college campus, Alexa, stop. When I worked on a college campus, I worked for the campus security office, a lot of issues that happened on campus overnight, including suicides. So I wanted to focus on being able to help college populations because I know that they're vulnerable, and even at hours that the student health center is not open, they may need our help. So that's one thing that we really focus on. If you look at a lot of our branding, we try to use, wording that college students will relate to. And so for some of the things they're dealing with, acne, I can see their skin, depression, we can talk about it, weight gain, diet and exercise, I don't need an actual physical exam. Also things like cancer, hospice, they really may just need that family support. They really might just need someone to talk to about what's going on. Are their medications being managed correctly? Is there something else you can do to help them? You can do that. Talking about risks for a heart disease. Maybe the person just needs to know if they need a stress test or not, and you can order that test. Ordering a mammogram with appropriate follow-up with a OB-GYN or primary care for a breast exam. There's a lot we can do. So follow-up. At the National Medical Association conference this week, I saw that there's a new telemedicine company out there. Excited to see that. Focusing on follow-ups for telemedicine visits after the hospital. I think it's a great model. It's something that I've talked about for years, so glad to see that somebody's doing it. And so it's telemedicine is a great way to do follow-ups with your patients that you have established relationships with, because if you don't do it, they're going to end up in urgent care or a minute clinic. So get out there. Second question, I hope that answered Dr. Butcher. If not, send me a tweet. Tisha, T-I-S-H-A, Rowe, R-O-W-E, M-D, with any follow-up questions, and we can have a tweet chat. Next question from Dr. Herman Tolliver. Liability is my biggest question. Hi, Dorothy. Thanks for joining. There are a ton of liability companies out there. I would suggest going to your local medical association, like I went through the Texas Medical Association, to see what they recommend in terms of liability insurance, and go, hi Nika, thanks for joining in, go with the liability company they recommend. Next question comes from David Foster. What happens in the case of emergency? If it's a true emergency, tell the patient to hang up and call 911. I still believe that we should use telemedicine for things that could potentially be an emergency, not a true emergency, but something like someone having chest pain. There are telemedicine companies out there. Hi, Dr. Butcher. Thanks for joining. I hope I'm pronouncing your name correctly. I actually just answered your question that you posted on my timeline a few weeks ago. But if it's a real emergency, you might be the person that helps them recognize it's an emergency and be able to get them to go to emergency room where they otherwise didn't think it was an emergency. Great case would be a pediatric patient with asthma, right? The patient's getting tired. To the mom, they may think, oh, well, they're not breathing as hard, but really they're becoming fatigued and they're about to tap out, right? But they don't know that. You could see that on camera and say, get your child to the nearest emergency center, not urgent care, to a pediatric emergency center now. Someone having a stroke, maybe they live alone, they don't realize what's happening. They talk to you, you immediately see that facial droop. You can tell them, call 911. You need to be going to a level, the appropriate level hospital within a couple hours so they can start treatment. So I think there are cases where emergencies can be handled. In fact, in Houston, they recently started, not recently, it's been a few years, a telemedicine company where they just do triage for emergencies, and it's actually through the city of Houston. So great opportunities for telemedicine. Next question comes from, this is a patient, not a doctor, but I'm going to address it here. The first question I answered today was, how do I get paid? This question from a patient comes with, how does billing work? And we actually talked about it, and I'm not sure, maybe, you know what, this is from a doctor, I apologize. And this is from Dr. Hubert. And so billing depends on if you're working for yourself or working for a company. If you're working for yourself, you can go through the general process of billing claims the same way you would office visits. There's some visits that will require modifiers, and with the appropriate software, you will be able to determine what visits require a modifier. Next question, not sure if it's a doctor or not, but is, what are common HIPAA compliant software platforms? Fees and billing. There are tons of software out there. I'm not going to speak to and endorse any specific one, but I would say do your research, find one that's a good fit for you, or join a network like Rowe where we vet the software for you. Fees and billing, I've addressed that already, but you can do concierge, pay cash. Yes, there's still tons of people out there willing to pay cash. You can build their insurance, or you can be contracted by a telemedicine company or directly by an employer and do fee for service. Next question comes from Joshua Anthony. He actually is a medical doctor as well. Will insurance pay for it? Easy, yes they will. And can you prescribe medication? Easy also, yes you can. The question with can you prescribe medication is, in some states there are restrictions on what types of medication you can prescribe, specifically controlled substances. So contact your medical board and you can find out from them if you can prescribe medication. If you're watching, hi Hisla, and you have questions, put them in the comments. I'm more than happy to address. These questions were posed to me directly on my personal timeline, and I just thought it would be great to be able to share this with the group as well. This question comes from a patient. Can I use the service from any country? If your doctor is licensed in that country, yes you can. We do have doctors in India, in Nigeria, in Trinidad, and in Jamaica. So we're hopefully looking forward to being global, having doctors everywhere. So if you know international doctors interested in telemedicine, feel free to send them to me, okay? And to Rowe. This question comes from Dr. Tiffany Turner. Can you do referral to specialists? Absolutely. In fact, in so many areas where there are a shortage of specialists, I think it can be extremely helpful. So I hope more specialists will start doing telemedicine, because people really need you. And for them to have to drive 2 or 3 hours to a medical center, if they live in a rural area, that's a huge burden. So come on, specialists, get on board. We want them to be able to offer you have your services available. And I really feel like as specialists, the opportunity to be in private practice as a telemedicine doctor is huge, because you can get patients from anywhere. We talked about malpractice already. That was a repeat question from Cheryl Martin. And then we have a question from Dr. Sam Dolocott. I think this is a doc. A lot of times in peds, yes it is, I thought so, ear infections are a cause for fever. How do the peds folks adequately assess febrile patients? So I'm going to say pediatrics, one of my favorite specialists, because you all are always so nice, but you all are probably the slowest to get on board for telemedicine. I think it's primarily because you want to protect your patients. You want to do the best care possible. But just realize that there are companies out here that are opening clinics with And nothing against nurse practitioners and PAs, but they're fresh out of school and they're manning these clinics by their own, right? So with your level of expertise, I'm not going to tell you that you have all the information you need to do an exam, but I'm going to tell you that with your knowledge base, you may be able to do a much better job virtually than that person in the office with no experience, okay? I've seen people dose the wrong dose for pediatric medication. So yeah, they saw in the air, but they went and prescribed the wrong dose for the patient. What is worse? I have had kids, special needs kids, really active kids, combative kids, that even with the help of their parents, we cannot hold them down to see in the air. What do I do in that febrile patient that I can't hold down and I cannot get the visualization I need of their TM? I do the best I can with what I have, and telemedicine is no different. Another question came from, this is from my sis, Michelle. How do you know if it's covered in my state or with my company as far as healthcare coverage is concerned? Most companies and insurances are covering it. If you have a patient that wants to know if they are covered, if they register with my website, rowedocs.com, ROWEDOCS.com, we will actually verify their insurance. They just have to ask. So welcome to the call. I see Mary and Keita joined. If you have any questions, I'm doing telemedicine Q&A based on some questions on my timeline. And if you go back to the beginning of the video, I gave you 3 events that you should attend this year regarding telemedicine. I'll be sure to announce those at the end again for those who may have missed it. So my apologies. Most states are covering it. If you're not sure, just ask. Next question is, how do I get trained to do it if I don't have any experience in telemedicine? That comes from Dr. Nina Onochi, and join Rowe Docs. That's how you'll get trained. Really, there isn't much training. If you know how to use FaceTime, you know how to log on to a computer, put in a username, password, and hit start, you know how to do telemedicine, okay? It's not anything special, but there's a lot more to it than the technology. There's the marketing, there's the operation, there's the workflow, and that's how Rowe Docs can be extremely helpful. And Ayana asked how is medical information protected? You all make sure you choose a HIPAA compliant platform so that your patient's information will be protected. That's the best thing that you can do. Next question comes from Felicia Sumner. How to deal with scheduled drugs. Can I set my own? How to deal with scheduled drugs. In some instances, you won't be able to do it. Check the laws for your state. Can I set my own prices for visits? If you're not contracted with insurance companies, absolutely. Can I have a membership price offering for patients 24/7? Yes, I've done it, and I highly recommend it. In fact, I highly recommend any doctor doing direct patient care incorporate telemedicine. At one point, I did a special where I was doing free startup for doctors with direct primary care, because I know it can be challenging getting that practice off the ground. So if you know anyone with DPC wanting to do telemedicine, send them to me. I'm more than happy to work with them. Next question is from Anna Moorhead. Questions on privacy. Same privacy, level of privacy for in-office. We're doing the same with telemedicine. Just make sure you choose the right company that you partner with. Next question comes from Beverly Nelson. How convenient is the process after requesting a service? How long the wait before contact? It depends on the company, but I'll tell you with Rowe Docs, we have a 24-hour turnaround for appointment requests. Then from one of my favorite doctors, Tamina McMillan, basically ditto what has already been said. My question is billing and reimbursement addressed. How not to lose your skills since you're technically not laying hands on patients. Welcome to the call, Ann. Thanks for joining. We're doing telemedicine question and answer. Tamina, I would say the best way to not lose your skills, still have a couple of days in office. I still do a day where I do physicals and see patients in office, and I'll continue to do that because you don't want to go completely telemedicine, I think, if you want to maintain those skills. Although I do think there will be a role for simply being a virtualist in the future. Again, Sam, in terms of scheduling, how many patients do I need to see per hour to make it financially worth it. It depends on if you're doing insurance or fee for service. If you do a concierge, you may only need to see 5 patients per day. If you do fee for service, you may need to do 15 patients per day, depending on the cost. If you're doing insurance or working for a teledoc or doctors on demand, you may need to do 20 patients per day. I don't know what your normal salary is, and that is what would determine the volume of patients you need to see. I think I got all of the questions. Oh, one more. Again, from Dr. Uchenna Ume, can a pediatrician do this? Absolutely. And how do you, and from Dr. Nat Cap, how do you increase your volume? Which states can help with multiple states? So sorry, I had to move my phone to see those questions. I would say to increase your volume, marketing is key. Do not hire a traditional telemedicine marketing company. They don't know jack about telemedicine. Sorry, they don't. I've gone through it. You will get burned. You'll go through a lot of money. Telemedicine marketing is an art that I have worked really hard to develop. Our site gets about anywhere from 5 to 20,000 visits a week. Our impressions on social media are great. We have great engagement. So the best thing I will say in terms of marketing is to join a team, be a part of a network. Don't try to reinvent the wheel. Don't try to do it all on your own. So I hope you found these questions helpful. If you have any further questions, visit our website, rowedocs.com. There's an area just for physicians, just about membership. And I'm going to repeat the events I shared at the beginning for those who came on a little later. Upcoming telemedicine events include ATA Edge in Austin, September 26th and 28th. VPS, Virtual Physician Summit in Atlanta, October 6th, a one-day conference, and Urgent Care Association of America Conference, October 12th to 14th, where I will be speaking at the pre-conference on October 11th. Guys, if you're on Twitter, Instagram, Facebook, connect with me, Tisha, Tisha, Rowe, Rowe, MD. Hi, Mona. Thanks, everyone, for joining. Reach out to me anytime you need help or have questions. I'm here to be a resource for you. Telemedicine is booming. It's an exciting time to be a virtualist, and I hope to see more of you online soon. Have a great night or a great day, Sunday.